know. Very nice. Like a butter. I mean, it's really dark. I always think of Princess Bride when I do this, you know. And remember, it's for posterity. So be honest. How does this make you feel? My sister got me once. I'm like, oh my gosh, Brenda, that's just wrong.
Yeah.
Yep.
Whew.
Congratulations. I saw
Thank you.
your newborn
Thank
baby
you. Yeah.
over there.
Got the baby.
Her in the background. She's
Yeah.
so sweet. 2
Thank
months
you.
old now.
2 months, yeah.
Oh, man.
2
Congratulations.
months. Thank you.
Tell me what's going on. You say you pulled something in your arm?
Yeah, so pulled tricep, getting a little work on it.
Just show it off a little
Yeah, cupping.
bit. Okay.
Cupping, bruising.
I feel like you might be cheating on me a little bit, but
Well,
yeah, all right.
you're so far away.
All right. Well, I won't dig in.
But just, I mean, with the baby kind of holding
Yeah.
her, it's hard to stay stretched and all that stuff. So I'm not doing as much of the stretching as I would like to do, but, still doing as much as possible.
I'll
to
loosen you up today.
Keep everything.
Get you get back to moving
Yeah,
on.
that's why we're here.
My wife would tell me, Ed, my favorite part of the day is you coming home and putting the kids to bed. It's my favorite thing that you do. Of all the things that you do.
Is it
Putting
bath?
that baby to
Is
bed.
it bath time for
Yes.
me?
Yeah, that's accurate.
It's
It's
now
nice
her-
to just like have a break. Exactly.
It's now her
So
favorite
it's-
thing that you do.
Yeah, it's like, hey, can you bathe her? And then it's like, hey, do you want to feed her? Because you haven't gotten to do that today. And then it's like,
It's
all
also
right.
good you got a bond.
I know, I'm not complaining. Cuts into the stretching time.
Be right there. I got you. Exhale. Nice, deep breath in. Hold on. Chin down. Exhale. Good, okay. Let's go to your side facing me. Exhale. How's that gonna be good enough?
But overall, I feel pretty good outside of the tricep.
Let's get you moving. There we go, relax. There you go. Very nice. Like a butter. There we go, relax here. Very nice. Yeah, the sounds aren't that loud if you notice. The sounds aren't loud because the distance, as you're stretching more and as you don't have these large gaps. Sometimes people are like, oh, that was a really good crunch. And I go, well, yeah, I mean, the bone was massively out of alignment.
Yeah.
But as a patient progresses generally, you get these like kind of softer clicks because you don't have these large amounts of air bubbles and gaps.
Mhm.
It all feels good. There we go. All right. So there's going to be a little bit of an ASMR with baby sounds in the background. Tiny baby sound. Oh.
Definitely have some tightness in like the hip and like the lower back.
Lower back on the right
Yeah,
side?
on the
Okay.
right side.
Put it right here. Holding the baby tension. Yeah, you went pretty
Mhm.
quick.
Yeah, they don't tell you to train for that,
Mm-hmm. And sure there needs to be some hydration.
Mm-hmm.
All right.
Yeah.
Got a picture of, we went to dinner, like, what we go, like Outback or something, and he's like, Charlie's about that size, and he's just like latched onto me like one of those mammals or something like that. He's like just grabbing onto me.
I think it was Carrabba's.
Is it Carrabba's? Yeah, he's just so cute. Little pocket babies.
Mm-hmm.
Little pocket baby.
Yeah. Especially with how small she was, it was just like, all right, just one forearm,
Right.
carrying her around.
It's hard to believe like humans that.
Yeah.
Mm-hmm.
like when they still bend their knees like they're still in the womb, they still bend their legs like they're like.
The knee
Yeah.
bone scrunch, yeah.
They're just naturally hanging out like that. It's like, how do you do that? Falls asleep like that. It's like, what?
Ooh, right there. Ooh.
Kind of goes through like moments of being tight versus not being tight, but it's not. The work I've been able to get has been good for it. It was pretty gunked up, and then
Yeah.
holding her a lot, kind of. Because without even thinking about it, I was talking to him. It's like, yeah, it's like this and this and this. And he goes, "You've been holding the baby with that arm?" And I was like, now that I think about it, yeah. It's like, well, okay, there you go.
It feels good. I mean, I don't. Like I said, he's got it all cleaned out. I don't have any like anything that feels tangled still. So
Mm-hmm.
now just needs to wait for this Epsom salt the best you can. Try to rinse this out.
Yeah.
I don't think there's anything left that's plugged.
Nice.
So, feels good.
You cried. The only time I've seen
All
him
four of my
cry
kids, I cried. when
at
they were
each
born.
birth. Really,
All
like
of
the
them. I
only
can't help
time
it.
I've seen him cry.
It's
So it's
so-
a good time. To
It's
cry.
so sad. They're so innocent. Makes me cry every time. Like last time, I was like, not gonna cry this time. Not gonna cry, Ed. I can't even stop it. I was like, okay, positive emotion. Not gonna cry. Not even gonna look. Just gonna look over here. Oh, look at that wall clock. That's an interesting wall clock.
You know, you do it every time. It's funny. I don't think. Did you cry, Todd?
No, it was a.
No,
It
I'm a
wasn't
real.
like-
I'm a real man.
Well, it was just
Just
like how
like-
everything went down. It was like,
Sure.
wait, what am I doing? Where am I going now? Like, okay.
Oh, yeah, like busy
Yeah.
worrying about everybody's okay.
Yeah.
Right.
I didn't think that Ed would cry because he's not a crier, like, or anything. So
Yeah.
I was shocked. I was like, I just seen him cry.
Just a little tight here, but not nearly as large as it used to be. Yeah. Try to go as deep as I can there, yeah.
I did take it with me on a plane too and used it, and that was,
Ooh,
that was
excellent.
great.
Get some looks from people around you. What is that guy?
Probably.
What is that guy putting in his bag over there?
It helped a lot to, like, I was almost like more comfortable, like sitting with it on the plane than I was without it. It's interesting.
We take ours everywhere, so.
And it was nice because I could like push into the tray.
Yes, yes,
Get into it.
yes, yes. Yeah, then it makes standing up so easy. It's like, I might have been a little uncomfortable while I was sitting, but oh my gosh, it's so easy to stand up now.
Yeah.
Yeah. Yeah. said the right side, is that correct? The right side?
Yeah.
Yeah, I feel it all. It starts from right here.
Yep.
This is all jammed right. A little more crunchy. Right there.
Is that causing the right side to?
This is definitely more locked over here.
Yeah.
It's definitely
Feels it.
right there. So usually, yeah, left lock will cause a right abuse. Usually we're overworked.
Yep. Whew.
That's really hurt.
Well, it doesn't usually make noise, so.
What is that?
This must hurt.
I went harder on the right side, and you were no problem. This side a little more. You can't hide from the elbow. There it is. There. Real quick. I mean, he pulled something on this left side. I would say, and then what's happening is you've injured your left here, and now you've compensated. And the pain you're describing is a compensatory pain. It's not. The right isn't doing anything wrong. I mean, very quickly on your left here, it came up. It's like your left hip got injured or left side got injured, and you're now throwing the work to your. Because I worked real hard on that, and you were not that upset with me. I go over here.
Yeah, as soon as you touched that, I was like, well, wait.
Uh-oh.
No?
I mean, it's really dark. Mm-hmm. Yeah. Yeah, there's definitely some over here too, but I don't know if it's not as much. Maybe a third, a quarter. There. I feel like this is doing better up here. I feel like one time we got like a real lot back here.
Mm-hmm.
This is all resolved. I had it described to me by certain patients. I feel like there's a gremlin and it just moves around in different places.
Yep.
Well, today it's in your left hip.
Yeah. Well, especially as like everything, opens up. It's just like, hey, remember that? It's like, huh?
Right.
Oh yeah.
You remember me.
Mm-hmm.
So tired. He's back.
Oh yeah. Felt all of that one. Felt all of that one.
So.
Yeah, it's because like I feel it here,
Mhm.
but like I would have never told you that was there,
Mhm.
which is
I
the
mean,
crazy
technically,
part.
I could do this. Like,
And that,
here we go.
that, like I said, that's where you were feeling it symptom-wise.
Mhm.
That's where you were hurting.
Yep.
But right, so there's an old injury or something opened up on that
Mm-hmm.
left side, and then compensating
Yeah.
the pain on the right.
Crazy how that works.
All right.
Can you do the sub gap?
Yeah, let's do that. Let's see.
Oh, go on the armpit?
Yeah.
That was always fun.
I saw that on so you posted the Instagram one, and I was like,
Oh, year of regret.
I know.
It's right there.
Yep.
Just hold. I always think of Princess Bride when I do this, And remember, it's for posterity. So be honest. How does this make you feel? My sister got me once. I'm like, oh my gosh, Brenda, that's just wrong.
Yeah. Because it just like turns that whole like this whole thing is just like, hey, what are we doing?
Mm-hmm. There we go.
Just for showy cracks.
One there. Mm-hmm. This is like when Carl was filming before with push back the elbow. Yeah. When Carl was filming with Charlie on a body wrap.
Talented.
Baby.
Push back the elbow. No. Thank you, baby. She's like thoughtfully like, what's going on around here? Aw. She's happy. Tilt your head right. Tilt it right. There we I don't adjust happy babies.
Yeah.
Tilt right. Yeah, when they're awake and a little cranky. Okay, perfect. Don't disturb the happy baby. Tilt to the left. Tilt. Okay. There it is. Nice. Got it.
Someone was asking Ed why you don't ever use the drop table piece that often, I guess.
It's too mild. If you could handle this, the drop piece is a little bit more gentle way to adjust the bones.
Is it because of like the momentum aspect?
It's just you're not getting near as much force in terms of mechanical,
Mm.
but it's working in a different way. You're trying to activate what they call the proprioceptors. So you're that same thing as like the adjustment is a sudden jolt, but it just works in a different way on the nervous system. But it's just, in my opinion, it's something I would resort to if somebody wasn't able to handle this or handle the gua sha, and then we just takes more visits to clear it with the drop piece. It's just milder. It's fine, just milder. Just drop it. Just another way to adjust it. Just another.
Yeah, it definitely feels milder too.
People that I want to be gentler on, I just, if you want to adjust someone's hip, you just, this piece comes up. It's just a gentler way to loosen this joint. Side posture is much more intense, and if you survive the intense ones, now we're going back to like white belt stuff to me.
Right.
It's like you've already done the black belt stuff. Why are we? And the bow move is about as black belt as it gets. I mean, it's about as I'm literally bending you backwards now. I mean, after you have that, I can't imagine the drop piece feels like, oh.
Yeah.
Our friend.
Always a pleasure.
Pleasure.
Thank you.
Thank you.
Yeah.